Hello, my name is Lexi Gann, and I'm a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a SCAT5 concussion assessment. So first you would do your immediate assessment on the field. The following elements should be assessed for all athletes who are suspected of having a concussion prior to proceeding to the neurocognitive assessment, and ideally should be done on field after the first aid/emergency care priorities are completed. So there's a list of red flags that you'd be looking for as the injury occurs if you're there, including neck pain or tenderness, double vision, weakness or tingling/burning in arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, increasingly restless, agitated, or combative. So if you see any of these red flags, you would immediately assume that they have a head injury and you would refer them. You would also be looking for these observable signs, including lying motionless on the playing surface, balance or gait difficulties, or motor incoordination, like stumbling, slow, or labored movements. We would look for disorientation or confusion, or an inability to respond appropriately to questions, a blank or vacant look, and facial injury after head trauma. So if you see any of those observable signs, that's also indicative of a concussion and you would want to refer them. Then you go to the memory assessment for Maddox questions. You're asking the patient these questions, and based on their answers, you're going to determine, it'll be able to help you determine if they have a concussion. So if they're unable to answer these questions correctly, then they could indicate confusion and possible concussion. So what venue are we at today?
My house.
Which half is the game in right now?
Definitely the third quarter.
Who scored last in this match?
I did.
What team did you play last week/game?
The other team.
Did your team win last game?
Yes, we did.
So she answered all those questions appropriately, and I would circle yes for the correct answers, and that would indicate she does not have a concussion, or it would be more likely that she doesn't. Next, we're going to the Glasgow Coma Scale. I'm looking for the best eye response. So currently her eyes are opening spontaneously. She's not sensitive, or her eyes aren't just opening when I talk to her, or her eyes are not closed. If they were just closed the whole time or only opening when I talk to her, that would be a lower score. We're also looking for best verbal response. She seems oriented. Best motor response, she obeys commands. So we're looking for, like on this scale, how her best eye response, best verbal response, and best motor response are, and the lower score would indicate that they're more likely to have a concussion. For example, if there was no verbal response, no eyes opening, or no motor response, probably would indicate concussion. Next, you're going to the cervical spine assessment. Does the athlete report that their neck is pain-free at rest? If there is no neck pain at rest, does the athlete have full range of motion, active pain-free range of motion? And is the limb strength and sensation normal? So if you have any of these symptoms, if you circled no for any of those, that could indicate a C-spine injury, which should also be related to a concussion. So those are all the quick on-the-field assessments you just go through really fast. Then if some of those seem like she could have concussion, you would go back and off the field and go through the rest of the SCAT5. So you're going to fill out the athlete background here, filling out things like date and time of injury, age, gender, those sort of things, and then also getting a brief medical history if they've ever had concussions in the past, and if they've ever had other head injuries. If they have any learning disabilities or things like that, that could change how their symptoms of a concussion might be shown. Next, you're going to the symptom evaluation. So the athlete would, if you could just read this paragraph out loud for me.
The athlete should be given this symptom form and asked to read this instruction paragraph out loud, then complete the symptom scale. For the baseline assessment, the athlete should rate his or her symptoms based on how he or she typically feels, and for the post-injury assessment, the athlete should rate their symptoms at this point in time.
Okay, so then the athlete would read through these symptoms, and she would rate these symptoms on a scale of none, mild, moderate, or severe. Things like headache, neck pain, sensitivity to light, drowsiness, etc. The total score would be out of 132 for symptom severity, and if the higher that score is, the more likely there could be a concussion. Then we're asking questions, do your symptoms get worse with physical activity? Do your symptoms get worse with mental activity? If 100% is feeling perfectly normal, what percent do you feel? If not 100%, why? So like I said, the higher up those symptoms are, the more likely there could be a concussion. So next we're going to cognitive screening. So what month is it?
It is May.
That is the date today.
The 25th.
What is the day of the week?
It is Friday.
What year is it?
2018.
What time is it right now, approximately?
4:17.
Wow, how did you know? So if the patient seemed really confused about those questions or couldn't answer appropriately, that could also indicate concussion. Now we're going to go on to the immediate memory component. I'm going to test your memory. I will read you a list of words, and when I'm done, repeat back to me as many words as you can remember in any order. Ready?
Mm-hmm.
Baby, monkey, perfume, sunset, iron.
Baby, monkey, perfume, sunset, iron.
Okay, I'm going to repeat the same list again. Repeat back as many words as you can remember in any order, even if you said the word before. Baby, monkey, perfume, sunset, iron.
Baby, monkey, perfume, sunset, iron.
Okay, and one more time. Baby, monkey, perfume, sunset, iron.
Baby, monkey, perfume, sunset, iron.
So I would record how many of those words she remembered and then add those up to a score out of 15. She got all 15 correct. She probably does not have a concussion. There's also an alternate list of 10 words, so if she did really well in that, we could go through the 10. Next, we'll go to the digits backwards. I'm going to read a string of numbers, and when I'm done, you repeat them back to me in reverse order of how I read them to you. For example, if I say 719, you would say 917. Okay, 493.
394.
629.
926.
3814.
4183.
62971.
171.
Okay, so as she got the list of 3 numbers correct and she got the list of 4 numbers correct. Then when we went to the list of 5, she stumbled a little bit, so we'll read the second option of list of 5 and see if she can get those correct. 15286.
68251.
So she did get the list of 5 correct, so we would circle yes. She would get 1 point for that, and then we'd move on to the list of 6. 718462.
24. Say I missed it.
Okay, let's try again. 539148.
841953.
That was close, but she did switch to the last 2, so we would circle no. She would get 0 points for that. So she got the first 3 sections right. 3 points out of 4. Next, we'll do the months in reverse order. Now tell me the months of the year in reverse order. Start with the last month and go backwards. So you'll say December, November. Go ahead.
December, November, October, September, August, July, June, May, April, and then just continue.
Okay, so if she got all those correct, it'd be a score 1 out of 1. So those are all the cognitive screenings. Now we're going to move on to neurological. Okay, so can the patient read aloud, which she already read her symptoms checklist, so we get yes for that. Does the patient have a full range of pain-free passive cervical spine motion? Okay, I'm going to move your spine. Okay, seems good. We would circle yes for that as well. Without moving their head or neck, can the patient look side to side and up and down without double vision? Okay, so follow my finger. Tell me if you're getting any symptoms of double vision.
No.
Okay, so circle yes. Can the patient perform the finger-to-nose coordination test normally? So if you would stand up for 1 second and then just touch your nose with one finger and then with the other. Any dizziness or headache or anything?
No.
Okay, so we would circle yes. Can the patient perform tandem gait normally? So stand with one foot right in front of the other. And we would circle yes for that as well. Okay, next, going along with this, we do the balance examination, best test. So which foot would you use to kick soccer ball?
My right one.
Right one. So we're going to be testing with the non-dominant foot, so we're going to use the left. So first we'll do this on a hard surface, and then we normally would do it with a different surface as well. So double leg stance, she's going to be standing on two legs, and then close your eyes, and then we would do this for 30 seconds. For 30 seconds, and then count how many times she stumbles or falls or tips over. Okay, so score, there's no error, so do 0. And then single leg stance, so you would stand on your left leg and then close your eyes again, and then we would do that again for 30 seconds, counting how many times she either puts down her leg or looks like she's going to fall over or brings up her forefoot off the ground. And then last was tandem stance. So your non-dominant, your left foot is going to be in the back and your right in the front. And then close your eyes again, and then again 30 seconds, counting the number of errors. So all of those were good. So we would put a score of 10 for all of those, with 0 errors. Delayed recall. So, so now do you remember the list of 5 words that I gave you?
Perfume, iron, sunset, monkey, and that's all.
So she got 4 out of 5. Good job. Those ones, the cognitive skills, you would want to compare to a baseline test to see how that compares to what her normal cognitive function would be. And then the last step, you would make a decision based on the number of symptoms and the severity. You would add up all of those numbers and make your decision on whether or not your patient has a concussion. If they do, you would then want to refer and send them home with concussion injury advice. I'm going to say that my patient does not have concussion. So, have a great day.